Hi there, my name's Monique de Beer and I am a registered physiotherapist. However, today I am a mother at home and I have a child with a chest infection, so I would like to show you how you could do some chest physiotherapy at home. If the child's been discharged from hospital, you may want to continue with the chest physiotherapy for a while, or even if you have to take the child back for outpatient visits on a daily basis, you can double up on that by doing the chest physio at home. Very importantly, you just need to check with your physiotherapist or your doctor if it's safe to do chest physiotherapy at home, as there are a few contraindications for chest physiotherapy. Like, for example, if you suspect a broken rib, all sort of small technical things like that. So very important, please check with your healthcare professional if it's safe to do chest physiotherapy at home. The important thing with doing chest physio, percussion specifically, is to not use a flat hand, but to use a cupped hand. That will trap some air, which means it'll be a lot more comfortable for the person receiving the treatment. You may want to practice it a little bit before you do the actual technique. So just take your hand, cup it. You can do it here on your chest and just do some percussions like that. Keep your hand rigid and make sure that the movement happens at the wrist. You can even do it on the other side. Make sure that you're able to use both hands, or you can even just practice on a pillow or on your legs. So once you've done that, you're comfortable with the technique and you can feel that you're not hurting yourself, you're ready to position your child or whoever you'd like to treat into the position. You're going to position your child with 2 pillows under the hips so that he lies with an angle to get gravity to assist draining the bottom lobes of the lungs. The postural drainage positions, they're different positions for different lobes, but this is sort of a one-size-fits-all position for the lower lobes. Make sure you remove any jewelry so that you don't hurt the person that you're treating. And then we're going to start the session. You're going to cup the hands so that you don't hurt the person. You can either do it with just one hand, or as you get more practiced, you can use both hands. From this position, you will then move the child into a side-lying position. I'm going to show you one side, but you ideally want to turn the patient onto both sides, and again do about 5 or 10 minutes on each side. If you want to target the upper lobes, front and back, you can position the child in sitting either on a chair or over the edge of the bed, and you can move from the front to the back to do the treatments. I'm going to show you how I do the treatments from the front onto the upper lobes at the back of the lungs. A chest physiotherapy session can be anything from 15 minutes to 30 minutes, depending on what your needs are and how long your arms can stand it, and how quickly the child or the person you're treating is responding to the treatment. If they have a very thin shirt on, or it's a smaller child and they may be a little bit sensitive, you can put a towel over the back or the area that you're treating and do the percussions through the towel. At the end of the session, you can get them to sit up, take a few deep breaths, and if they can, you can ask them to give a couple of nice hard coughs so that they can start moving out the secretions that you've just loosened with your percussions. Thank you very much for watching. You're more than welcome to visit my website to get more information there. You can contact me if you need more advice or would like to book an appointment. So thank you for watching, and I'll see you next time. Keep well.